An epidemic of loneliness and isolation. In 1964, then Surgeon General Luther L. Terry released a landmark report linking cigarette smoking with lung cancer, bronchitis, and cardiovascular disease. Since that time, surgeon generals have taken on the role of advising the American public about such health crises as opiate addiction, oral health, prevention, and the e-cigarette epidemic. In May of 2023, Surgeon General Vivek Murthy, currently serving his second term as the nation's doctor, raised a cry of alarm about social isolation and loneliness in the United States in a report called Our Epidemic of Loneliness and Isolation. In the report, Dr. Murthy equates loneliness to the effects of smoking 15 cigarettes a day, an impact in our health more than obesity, air pollution, and physical inactivity. Loneliness is associated with a greater risk of cardiovascular disease, dementia, stroke, depression, anxiety, and premature death. He says in the report, it is a plague that affects our schools and our workplaces and diminishes all aspects of our lives. Fighting loneliness may only require that we answer that phone call from a friend, make time to share a meal, listen without the distraction of your phone, perform an act of service, express yourself authentically, as Dr. Murthy says in his introduction to the study. Unlike cigarette smoking, the signs that somebody is lonely are often harder to spot, but they include notice changes in mood, such as anger, frustration, or disengagement, inconsistencies in sleep patterns, changes in appetite, increases in time spent at home alone, alterations in phone use, accelerations in internet reliance, spikes in shopping habits, increases in substance misuse. Studies have shown that our relationship with others is a critical contributor to the health of the individual and to the population. However, too many Americans lack the social connectedness needed to stave off loneliness and social isolation. Although the pandemic exacerbated the situation, studies from as early as 2003 showed that social engagement was decreasing and social isolation was on an upward trend. No matter how much of a loner you are, human beings are one of the most social of all animals. When we have insufficient engagement with others for any reason, such as work life, that isolation can be linked to decrements in mental and physical health. Researchers in one U.S. loneliness study coined the phrase, isolation is being by yourself. Loneliness is not liking it. Who is lonely? Just about everyone. There are no age-related predictors of loneliness. Living alone, having poor health, infrequent social interaction, and being unmarried are predictors for every age group, or predictors for every age group. Being socially connected, according to Dr. Murthy, is medicine that's hiding in plain sight. And it's what we need to take advantage of and to cultivate in this moment where too many people are struggling with loneliness. I want people to know that the consequences of social disconnection are quite profound. And they have a cost associated with them too. Not just a human cost, but a financial cost in terms of increased healthcare costs and broader societal costs, he said in a recent interview. In the US, loneliness costs US employers an estimated $154 billion annually, and it costs the US an estimated $6.7 billion in excess Medicare spending due to increased hospital and nursing home costs. This means that even if you are not one of the lonely, it affects your life as a member of a community and of society. You cannot take a pill, have surgery, or exclude something in your life to meet the minimum requirements and be considered socially connected. To avoid loneliness, it's an ongoing process that you must participate in throughout your life. The three vital components of social connectedness are the number and variety of relationships and frequency of interactions, the degree to which relationships serve your needs, and the quality of those relationships and interactions. From 2003 to 2020, the average time a person spent alone increased from 285 minutes per day to 333 minutes per day, an increase of 24 hours per month spent alone. At the same time, social participation decreased by 60 minutes per day to 20 minutes per day. That decrease is starkest among young people ages 15 to 24. In the same manner, close friendships have also declined. Amongst those not reporting loneliness, nearly 90% have 3 or more confidants, yet nearly 50% of Americans reported 3 or fewer close friends. So, how do you improve your social connections? Reform your digital environment by creating spaces in your life without the distraction of devices. The current phrase is digital detox, but it essentially means creating a space without computers and devices where you can go somewhere as friends or family and spend time with each other without the distraction of electronic devices. Technology is a tool, allowing us to communicate with people we cannot otherwise reach. People of all ages spend less time with others. Spending time online takes away from in-person interaction. We need to limit that. A website called Time to Log Off focuses on ways to help people wean themselves from a 24/7 digital life. Extend kindness towards others and towards yourself. Kindness has moved from what once was considered a soft topic with very little exploration as to what it means to something of a hot button topic. We especially saw this during the pandemic. A study run during the pandemic involved a questionnaire that 60,000 people from 144 countries took, and which eventually led to a series on the BBC called The Anatomy of Kindness. Volunteer, and you will have a fantastic way to develop contact with other people, provide opportunities to give back, and provide a purpose and meaning in your life. Volunteer, and you will get to know yourself, broaden your horizons, and likely develop personal relationships and engagements with others. Volunteers not only live longer, but feel less lonely and get a chance to make a difference.